Hello, welcome you all to the next topic, that is hemochromatosis. It is an inherited condition where the iron levels in the body slowly builds up over many years. So we are going to see in detail what is genetic hemochromatosis, which is coming under the unit 3, genetic conditions of adolescent and adult. So stay tuned to watch more about and learn more about hemochromatosis. So this is actually the buildup of iron, or otherwise we call it as the iron overload, which can cause many unpleasant symptoms to a client in many parts of the body, such as the liver, joints, pancreas, and even heart. So when you go through this picture, you can see I have given both, that is a healthy liver as well as iron overloaded liver, which shows more and more of iron deposits on all the lobules, as well as the size of the liver is also very much increased, which is having a direct impact as well as indirect impact on many end organs. So this is actually acquired. It can be acquired or even through a genetic nature. So wherein there is high pathological level of iron accumulation in the body. We can otherwise call these patients as bronze diabetes due to the discolorization of the skin and also associated disease of pancreas. So this is a very rare disorder which is purely of autosomal recessive disorder, and you can see majority of the people being affected with this are whites. So what are chromatosis. So here you can divide them into three major types, such as the primary, the secondary, and the neonatal hemochromatosis. So we'll see one by one what are the major types, focusing from the primary. In primary, you can divide them into further classifications as type 1, type 2, type 3, and type 4. And this here, the type 1 is mostly in adults, mostly females are more being affected after the menopausal stage, and in type 2 it is purely of juvenile onset, that is in childhood, and this is mainly affecting the secretion of the sex hormones as well as the puberty of the child. And in type 3 it is like intermittent, it can occur either the age before 30, and in type 4 you can see that it is like clients is going to being developed with more and more of um, the deposits of ferroprotein, which is caused by mutations of SLC40A1 gene, and this is more predominantly seen in European states. Coming to the next two type is secondary and neonatal. The secondary is mostly due to the large amount of iron accumulation in the dietary pattern, and in neonatal it is mostly due to the injury to the liver which causes during the fetal period. So now we will go into the glimpses of what are the major signs and symptoms of hemochromatosis. So the here majorly you can see the picture, that is like due to the iron overload, all the organs are being affected, starting from the liver, where patient is developing liver cirrhosis, and if the target organ is on the skin patient is showing of bronze pigmentation, which is skin hyperpigmentation on the skin. And if the the pancreas are affected, then the patients are showing with a condition known as bronze diabetes. And here even the testicles and other reproductive organ, that is the ovaries, are also involved, which causes significant changes in the patient. So how we can test these iron deposits? So the first test is that serum ferritin. Then we can also plan in for testing serum transferrin saturation, which we call it as TSAT. So in this test we can analyze how much amount of iron is being bounded onto the blood which is carrying the iron. Full blood count, that is complete blood count, can be analyzed, as well as the liver is involved majorly, we will be going for the liver function test. So how the treatment goes on for these cases is that we can divide the treatment into two major phases. One is the induction phase and the other one is the maintenance phase. In the induction phase, the blood is removed frequently, and usually weekly we will be planning to remove the blood that is patient may need in for that is venous cut down, and then we have to transfuse for some other replacements such as fluids and blood. Often in maintenance phase we are not going to do phlebotomy quite frequently. Instead we will be trying to maintain the patient's iron level. Here in this picture you can see that phlebotomy were commonly for hemochromatosis we plan in for therapeutic phlebotomy, that is we are going to totally remove for example if we are planning to remove 200 or 250 ml of blood today, whole blood, then the patient may be replaced with either oral fluids or might be through IV fluids to combat or to prevent the hypovolemia. So here in this, the patient will be having large amount of RBCs when compared to the other normal individual. Next, coming to the summary, you can see here is that hemochromatosis, majorly as I told you, it can be of primary origin or secondary origin, and whichever organ is being affected, it goes in for increased fibrotic changes as well as changes in the liver as well as the end organs such as the heart, the lung, the pancreas, and so on. So the possible treatments, remedial treatment will be planning in for removing of all the what is it gene screening of genetic condition, and we'll be treating the patient as per symptomatic management. The symptoms of so to conclude, the patient will be of majorly symptom like excessive tiredness, feeling of joint pain, bronze color, discolorization of the skin, heart may have feel flutter which we call it as palpitation, and loss of libido, decreased blood supply in the skin because a large amount of blood cells are there rather than the plasma, where the body growth of hair is also reduced. So to conclude, by the end of this class, I think you would have come across of what is hemochromatosis, how to describe any four signs and symptoms of hemochromatosis, and what are the major diagnostic findings we can plan for hemochromatosis, which I told you like serum ferritin and transferrin saturation or liver biopsy or MRI can be done for confirmatory diagnosis. The home remedies is that we give the patient take home message is that to avoid alcohol which can worsen the liver damage, and they should not eat any raw or fish or shellfish which is having high bacteria, so that can cause infection to the patient who are having high level of iron. And these patients should not take vitamin C supplements because it can increase the iron absorption, so they have to decrease the content of vitamin C intake, and they should not have any sort of multivitamins or iron supplements, and they also have to avoid any fortified foods like if it is mixed with milk or cereals, iron fortified foods to be totally avoided, as well as they have to reduce the intake of oysters, mussels, or like the meat, goat's meat, spinaches, which can at least reduce the increased amount of iron capacity in the blood. So far, thank you so much for your patient listening. I hope so you understood the full concept of what is hemochromatosis. So if you have any doubts or queries, please don't forget to put into the comment section. And for further videos or further lectures, please give me a valuable suggestion so that we could move further. Thank you all. Thank you for your patient listening.